The rising incidence of respiratory infections is a national concern, and the wider impacts of the fall surge that we are seeing. Children are being hit particularly hard, and that's playing out in Canada's classrooms.
It shifts your focus sometime early in the morning when I start to receive notices of not only of teachers that are homesick or their child has gotten sick or a substitute canceling because the substitute is now sick.
Absenteeism way up from normal average at this time of year, and the blame, that triple threat, COVID, RSV, and flu. With so many kids homesick, it's posing complications for parents. It's causing ripple effects into emergency departments. And let's just check in on the very latest with Hilary Johnstone in Ottawa. Good morning, Hilary.
Good morning, Heather. Well, we've been hearing these sorts of stories, these sorts of anecdotes from coast to coast. So starting there with that principal on Prince Edward Island talking about, it's not just the teachers that are getting sick, but the substitutes as well. And we have some recent numbers from Quebec's Ministry of Education, which shows on Monday of this week, 150,000 students were absent. That is much higher than you would usually see. So that's almost a 13 or 14% rate of absenteeism. It's usually somewhere between 5 and 7%. So quite a concerning situation, of course, especially when so much has been done to try and make sure that schools can actually stay open. And of course, now because of this triple threat that we've been speaking about, you have so many both students and staff members who are not in school. So of course, one of the ideas that has been proposed, again, right across the country, are to bring back mask mandates in certain school boards. And that was up for debate in Ottawa within the Ottawa-Carleton District School Board earlier this week, the biggest school board in the region. They were voting on whether or not to bring back a mask mandate. This is a little bit of what happened during that meeting. So you can hear some protesters there who interrupted the meeting. There were parents on both sides of the issue that spoke, but it all ended when police had to be called along with other security officials because things got out of hand. The meeting was actually canceled and they still have not voted on whether or not to bring masks back. So a very heated issue right now at the same time, like we're saying, that you're seeing so many kids and teachers out of the class.
And what is the latest we're hearing, Hilary, from health officials about this?
Well, of course, there's a lot of concerns, especially because so many of those kids, of course, are now ending up in emergency rooms. So if you take Ontario as one example, the Lennon Health Sciences Centre, the Children's Hospital in Lennon, Ontario, is actually cancelling some non-urgent procedures right now. Kids who are 14 years of age and older, in some cases, are being moved to adult ICUs to try and create space because we're hearing from that hospital that there's simply over capacity. Now, Ontario, the provincial government, recently sent a memo to some family health teams and clinics that are run by nurse practitioners requesting that they stay open longer, 7 days a week, to try and see as many kids as possible to avoid or prevent them from ending up in the province's emergency room. So here's a little bit of what we heard from Sylvia Jones.
It seems pretty clear they're asking somehow for us to start working 7 days a week, including evenings, without any mention of how that's actually going to be possible. So, I mean, it just seems ridiculous. You can't squeeze like blood from a stone. Like we're doing what we can, and there's no more to give at this point.
Okay, so that was actually the family physician clip I was going to throw to. So there was a little bit of reaction from a family doctor in Ontario being asked to stay open longer. Of course, all of that in response to this request that we did have from the province. I do believe that we have that clip as well.
They are already working very hard and working very long hours, and there have been changes in many provinces that have asked them to do more, to take on more patients, to work more hours, to have more coverage. And this is all in an effort to offload emergency rooms, which is really important. But again, we need system level solutions. You can't just see very full emergency rooms and say, well, okay, well, let's make family doctors work harder, as if they have that capacity and as if they're not already working hard enough.
So, of course, hearing there from both doctors who are being asked to stay longer and then some other experts in the province about what all that means for the healthcare system. Hearing there that you simply can't ask doctors to continue to work even more, work longer hours, that they are already burnt out. But that's just a little bit of what we're seeing, Heather, from across the country.
Hilary, thank you very much.